time and time again, the people that use social care services and health services tell us how fed up they are with having to tell their story to a social worker one day, community nurse the next day.
All of the different places are battling for the same cause, but they do it separately, so they're not as effective, whereas if they all teamed up together, they'd make a lot more impact to be able to help people a lot better.
When different agencies don't work in an integrated way, outcomes can be poor.
It's often service users or carers who are having to make up for a lack of an integrated service. They're in effect having to plug our gaps.
No one ever signposted me to an organisation that could have helped. It was me sitting on the internet going, I need something more than this.
But studies have shown that where successful integrated working is happening, service users and carers report good outcomes.
Service users in integrated teams were more satisfied with the quality of their care, they were more likely to say that they had been involved, and they were more likely to say things like that they'd been fully informed about their medication and needs in those kinds of respects too.
The Social Care Institute for Excellence has drawn on research to pinpoint the factors behind successful integrated working and to create an online tool to help health and social care agencies plan and deliver effective joint working.
That brings us nicely on to the next question, really.
The tool has a series of questions which enable guided discussions on key integrated working issues.
I think the benefits of using the tool have meant that we've been able to make sure that we cover all of the thinking that needs to take place to both plan but also to implement integrated working. It forces you to make sure that you've considered all of the different aspects that are going to be important and vital.
Each of the questions is supported with information and videos featuring health and social care practitioners, managers, researchers, service users and carers. The questions enable discussion around a number of key issues: organisational, cultural and professional, contextual, and co-production issues relating to service users and carers.
If you go out with a member
The tool, called Integrated Working Step by Step, has a series of questions which enable guided discussions on key integrated working issues. Groups can work systematically through the questions over several sessions if required, or they can prioritise questions which are most important to their service users and to carers.
For me, the best thing about using the tool is that it makes us come together. It makes us have the conversation. It makes us really make sure that we are thinking about, well, what is it that our local people need? What is it that we can provide for them in an integrated and coherent way, not what's simpler for us as an individual organisation.
Integrated Working Step by Step provides a highly practical way for agencies, in effect, to create their own blueprints for successful integrated working.
I think when NHS and social service do work together, we can get calling great Britain again.